Thank you so much for joining us, everyone. We are going to get started momentarily. Just hang out and we'll get going shortly. Thanks everyone for joining. We'll be getting started in just a minute. Thanks everyone for joining. We'll be getting started momentarily. Hello to everyone. A warm hello and aloha to you all. Thank you so much for joining us tonight for Ask Me, our educational webinar series. My name is Audra Hines, Vice President of Care Services for the Golden West chapter of the ALS Association. We could not make programs like this one tonight possible without generous donations to the Golden West chapter. And I want to thank our lead sponsor for the Ask Me series, Mitsubishi Tanabe Pharma America, as well as our special donors, including the Ron Malone family and the Morris family. Tonight marks our 20th installment of this Ask Me series that we began in 2020. This is an exciting achievement for our chapter, and we're really grateful for tremendous contributions from our strong partners and amazing individuals who continue to fuel these incredible programs. As a part of Mitsubishi Tanabe Pharma America's commitment to our ALS community, we have a special guest tonight who would like to make a couple of opening remarks. Dr. Gustavo Suarez Zambrano is the Vice President of Medical Affairs with Mitsubishi Tanabe Pharma America, and we're thrilled he could be here tonight. Dr. Suarez Zambrano, we want to express our sincere gratitude for your support, and the floor is yours.
Okay, so thank you very much. I hope you can hear me okay.
Yeah, we can hear you.
Perfect. So again, thank you for having me and for the opportunity to introduce tonight's Golden West educational webinar titled Ask Me, the Importance of Multidisciplinary Care in ALS with the UCSF ALS Care Team, presented by Dr. Catherine Lomenherth. I'm thrilled to provide the opening remarks for this presentation on multidisciplinary care. As we know, every person with ALS has a unique experience living with this disease, which means that treatment and care plans must also be unique and designed for each patient. We also know that multidisciplinary care may increase survival for people living with ALS. For those living with this disease and their families, we are grateful the ALS Association plays a critical role in helping to connect people with these much needed resources. Mitsubishi Tanabe Pharma America and the ALS Association Golden West chapter have a long-standing partnership and share the same drive and determination to fight ALS. While we work toward this shared mission every day, May is a great time of the year to put an extra spotlight on ALS, with this month being ALS Awareness Month. ALS Awareness Month provides a platform for our entire community to work together and lift our voices to drive much needed education and awareness across the US. We'll never give up in the fight against ALS. And by driving awareness of the disease, we get one step closer to improving the lives of those of you living with ALS. We have a tremendous admiration for the work and effort made by the ALS community to ensure everyone has access to multidisciplinary resources and services they need. At Mitsubishi Tanabe, we're honored and humbled to be a piece of everything you all do. Thanks again to the Golden West chapter for organizing this educational Ask Me webinar series, which is designed to address the tough questions of living with ALS. And thank you to Dr. Lomenherth and her team for all the service to the ALS community while leading the UCSF ALS Center. Thank you very much, and I hope you enjoyed the seminar.
Thank you so much for those remarks. We really appreciate your time, your support, and your commitment in being here tonight. Thank you. As he mentioned, many of you know that the month of May is ALS Awareness Month. The mission of the Golden West chapter is clear: to discover treatments and cures for ALS, and to serve, advocate for, and empower people affected by ALS to live their lives to the fullest. Ensuring that we're at the forefront of spreading awareness of ALS is a part of our work every day in achieving our mission. Whether it's the integral services provided by our care managers who work tirelessly with our ALS families to provide care and support, or our outreach staff who drive our community events and awareness campaigns, or our development team who constantly work to provide support to continue to fund our mission activities, or our marketing and operations teams who are the engines behind the curtain. We're here in our vision to ultimately create a world without ALS. But we can't do it without you, our valued, trusted members of the community who know the most about this disease. Raising awareness around the challenges of a rare disease like ALS takes committed people who are resolved in doing the work that expands knowledge of the disease. We're confident that with enough committed people, we can one day defeat ALS. To learn more about ways that you can spread awareness about ALS and the Golden West chapter, please visit alsagoldenwest.org for more information. In collaboration with one of the chapter's ALS certified treatment centers at UC San Francisco, tonight we're bringing a presentation and discussion to you on the topic of multidisciplinary care in treating ALS. This treatment model is proven to increase longevity and quality of life in many cases. Having access to specialty care within the disciplines of neurology, respiratory care and pulmonology, physical therapy, occupational therapy, speech therapy, nutrition and social work and mental health are all critical elements of a qualified ALS care team. We're pleased to partner with the team at UCSF as it's one of the many clinics that our care managers are connected to and embedded in as a part of the multidisciplinary team. Dr. Catherine Lomenherth is a professor of clinical neurology, chief of the neuromuscular division, and director of the ALS Center at UCSF. She's no stranger to being a part of our chapter programs and of this Ask Me series. Dr. Lomenherth, I'm going to let you introduce the members of your amazing team. I'm really excited we could pull everyone together tonight and get the whole band here. So I will let you take it away.
Thank you so much for your kind introduction, Audra. And if our team could take themselves back on video, I'd like to be able to introduce you. So as Audra mentioned, I'm a neurologist, but I could not do what I do with ALS without our multidisciplinary team. There's so many aspects of the disease that really need care beyond a neurologist. And so I'm very fortunate to work with this team. We have about to expand to 3 multidisciplinary clinic days per week. And we have satellite clinics in Fresno, Modesto, Santa Rosa, and Monterey, where we take our full multidisciplinary team. And I work with neurologists Rossau Sampagarno, Tara Long, and starting in July, Gus Linga. So very fortunate to work with our group. And so now I would just like our team to briefly popcorn and introduce yourself, and then we'll dive into the slides. We have slides from a few of our team members, and then we're all here to help answer questions at the end. So do you want to start, Patricia?
Sure. My name is Patricia Liu, and I'm a speech language pathologist with the group. I'll hand it over to David.
Hi, I'm David Bessio. I'm a dietitian on the team, and I'll pass it over to Madeline, who many of you probably know.
Hi, I'm Madeline Thompson, the social worker on the team, and I'll pass it over to Jessica.
Hi, I'm Jessica Mock. I'm the occupational therapist of the team, and I'll pass it to Alex.
Hi, everyone. I'm Alex Dean. I'm the physical therapist, and I'll pass it on to Mira.
Hi, I'm Mira Clayton. I'm the respiratory therapist on the team.
And then do you want to pass it off to Lauren? And if you can both come off video.
Yes, I'll pass it off to Lauren.
I'm Lauren Leonard, and I'm another respiratory therapist on the team.
Right. And if our three nurses could come off video and briefly introduce themselves.
I'm Ryan. I'm one of the nurses on the team.
Hi, I'm Annie. I'm one of the nurses on the team. Not sure you can see me.
And then Michelle.
Sorry. I'm Michelle. I'm also one of the nurses working in the ALS clinic.
Okay, thank you, everyone. So now I'll just start sharing the slides, and Madeline is going to be starting our presentation. And please go ahead and send in your questions in the Q&A, and we'll make sure to stay, if we run a little over, we'll stay afterwards and make sure all your questions are answered. So without further ado, we will get started. Okay, Madeline.
Okay, thank you. I don't really have any slides, I think, other than that one. Okay, there we go. I do. Thank you very much. I wanted to be introducing to you today the role of the social worker on the clinic team. It is a privilege, I just have to say this, it's a privilege to work with this team, the physicians and the clinicians. They have the highest expertise and commitment to their patients and to working with all of us in a very collaborative and communicative manner. And it's an honor for me to work with our patients and their families. As the social worker, I meet with persons with ALS and their families during clinic visits. I present information and education as indicated by their needs, questions, and concerns, including information on accessing benefits, referrals to appropriate community resources, state and nonprofit organizations, mental health counseling, resources for children and teens, and caregiving options. During my discussions with clients and their families, I become familiar with their needs and the benefits available to them. It is not only the person who has the disease who is important, but also family members. It is so important for caregivers to take care of themselves. Many newly diagnosed patients are working and may continue working for quite some time. Initially, I educate on government benefits, federal, state, and veterans. One federal law is the ALS Disability Insurance Access Act of 2019, which eliminated the 5-month Social Security disability waiting period. For a person to be eligible, he must not be receiving their full retirement Social Security benefit and have paid into Social Security and Medicare for 5 of the 10 previous years. I give information on Medi-Cal and in-home supportive services. On July 1st, 2022, just around the corner now, the Medi-Cal asset test will significantly increase for the aged and disabled, medically needy with a share of cost, and long-term care Medi-Cal programs. I encourage everyone to explore the details of the new regulations on the internet for Medi-Cal and apply if you think there is even the slightest chance of being eligible. Military veterans with 3 months active duty and honorary discharge are qualified for 100% service-connected compensation, which offers monthly income and other benefits. I refer to the Paralyzed Veterans of America to assist with this application process. Basically, I help families and patients navigate the non-medical aspects of ALS, financial, psychosocial, emotional needs, community resources, and benefits. A major and incredibly important community resource available to persons with the ALS is the Golden West chapter of the ALS Association, who's sponsoring this presentation tonight. or local chapters wherever they may live. I facilitate the connection to these chapters. These incredible and skilled chapter care managers are the boots on the ground. They have specialized and specific knowledge of their particular community's resources, as well as are knowledgeable overall with global benefits. They assist with resources, referrals, and support of the family. The care managers provide access to the wide variety of support groups and the chapter's loan programs and quality of life grants. And you can see some of the topics here of the support groups. Really, truly a wide variety that is very, very essential. I communicate regularly with the care managers and with the team members to facilitate access to the needed services, information, and programs. That's all I have. These are the support groups, lots of different things.
Thanks, Madeline. And now we have Alex speaking from physical therapy.
Hi, everyone. Glad to be here, and I'm happy to share what knowledge I have on physical therapy. Can we go to the next slide? So within physical therapy, our goal is and always will be to focus on maximizing your function so that you can do whatever it is you find enjoyable and find value in everyday life. And it helps us to stage then based on where a person is in terms of the disease process. So whether it's in the early, moderate, or early middle stages, and we're focusing more on restoration, on figuring out adaptations in your environment, figuring out how to get you into the right hands, whether it's with us or with a local physical therapist location, and into the later stages on comfort, on finding you the appropriate equipment, and on making sure that you can be as mobile as possible wherever you are. And I can go on and talk about it, but on the next slide, there's going to be a few of the things that we are considering. And this, of course, is going to be personalized. Every person comes in with a distinct set of issues, concerns, levels of functioning, and in each physical therapy evaluation, we're going to be looking at that. We're going to be talking to see what's your environment, what are you wanting to be able to do, what do you feel like there are deficits in doing, and then based on that, we can figure out how to go from there, and on whether it's as simple as a consultation or whether it's on actually doing certain exercises, which brings me to the next slide. And a question that I'm often asked, should I exercise, or is it safe to exercise? And is this going to help me at all? And even what kind of exercises should I be doing? And what I want to emphasize on the next slide is, yes, it is safe to exercise, and it can help with management of a lot of the symptoms. So when I say a lot of the symptoms, I mean the weakness, the difficulty moving, and the pain that can develop from not getting yourself around. So the ALS can cause symptoms up to a certain point in lowering the ceiling of function. But if you're not working to that ceiling and getting yourself to do as much as you can within that framework, then the secondary issues of sedentary behavior start to kick in. You take anybody who doesn't move as much as they can or to some amount, and they aren't able to do things because it hurts or because they're afraid of moving, and the muscles start to atrophy even further. And that's where the exercise can be a benefit. And when it comes to exercise, truthfully, it's any form that's valuable for you. Gardening, swimming, walking, using the elliptical, being able to walk your dog. Any kind of exercise is going to be beneficial, and our goal is to figure out how to get you in tune with doing that. The only consideration we do have with exercise is to not overexert yourself, and if the muscles are weak, to not strengthen them. And what we mean by that is if you're unable to move your muscles, anti-gravity. So the best example I can give is if you just look at my arm as I'm bringing it up, I'm moving it against gravity that's pulling me down. If there is difficulty with that, then we would consider compensating and not doing specific exercise activities, a formal form of exercise, such as lifting weights, but everyday activities, being able to eat, being able to brush your teeth, and being able to do all of your normal everyday things, we still want to encourage as much as possible. So in the end, when it comes to our goal is to keep you mobile as much as we can, or figuring out what tools you need to stay mobile, encouraging exercise and implementing that practice and trying to model it to what's specific for your needs. And then figuring out when it gets to a point of where exercise may not always be beneficial, or how do we get around that and how do we keep you as comfortable as we can. Thank you for your time.
Thank you so much, Alex. And next we have Jessica, our occupational therapist.
Right. For some reason, I can't start my video because it said the host stopped the video. So
we can see you okay, though.
So you can see me? Okay, yeah. Got it.
We can hear you. So that's, oh, now we can see you and hear you.
Okay, thank you. So I'm Jessica. I'm the occupational therapist on the team. My role, next slide. All right, so my role as an OT managing patient with ALS is to help maintain independence with activities in daily living. So including self-care, work, leisure activities, and also to improve quality of life. I work closely with Alex and other physical therapists on the team to address these issues as well, referring to what Alex just said about the stages of ALS. So next slide. These stages are just general trends of the disease process that affect daily function. So the early stage, patient with ALS might begin to have some hand weakness, especially like the thumb muscles, the pincer muscles that might affect fine motor skills such as buttoning, zipping, shoe tying, opening a Ziploc bag, etc. They might also experiencing some hand cramping, which could be a sign of fatigue. At the early stage, an OT can provide strategies to adapt the activities to make it easier for you to manage your daily task. Also, another important topic that we start early to talk about is to talk about home modification, even though the patient may not have the needs yet, but we want to start thinking about it. So when the time comes, we are ready. And then another thing that we talk about early on is stretching exercise and also range of motion exercise. Because as like what Alex is saying, if the muscles get weak, sometimes it will get stiff. So we generally recommend patients to start doing the range of motion exercise early on to maintain flexibility and to also will help with cramping. Next slide. And then the middle stage of ALS is patient may have significant weakness in their arms and their legs. They might have difficulty transferring. They get tired very easily. They might have some neck weakness. They might have difficulty accessing the computer and phone. As an OT, we again adapt the activities to compensate for the weakness and to maintain independence. We also start providing caregiver training in the areas of like transfer training and also range of motion exercise. We might talk about splinting and bracing recommendation at this time. We'll also discuss home modification to make it easier for you to navigate the house. In this stage, it's important to start thinking about if you need a power wheelchair or not, since it takes a long time to process. Next slide. The late stage of ALS, patient will likely require dependent assistance with all the daily activities and transfers. And as an OT, I focus on caregiver training. We focus on positioning for comfort and pressure relief, edema management, and also we'll look into wheelchair modification if driving a power wheelchair is getting harder if you're using a standard joystick. Next slide. And then another big topic at OT will discuss with you, just like what Alex said, is energy conservation. And we educate patients early. So think about energy as the money in your bank account. If you use it all up at once, it is very hard to save it back up. So why do we need to conserve energy? Is because muscle weakness causing fatigue. And how do we do that? We incorporate rest breaks, so rest before you get tired, which is very important. We prioritize your activities so that you can do things that you truly enjoy. And then you modify your activities. So for example, if you sit to get dressed or sit to take a shower, that will conserve your energy. So the rule of thumb is if the activities of the day leave you tired the next day, then you have probably done too much and need to learn how to kind of scale back your activities. And the outcome is it will improve your quality of life and you'll be able to participate in meaningful activities. All right, next slide. And I think I'll pass it on to Patricia.
Hi, everyone. My name is Patricia again from speech therapy. Next slide. So the first half of what we do in speech therapy is we help to support communication. Maybe some of the most obvious ways that ALS can impact communication is that it can cause weakness in different body parts. Day to day, we do most of our communicating with our mouth and with our hands, verbally, through writing, texting, typing. So as much as possible, we try to come up with strategies to support communicating with these body parts that come naturally to us. So if somebody is starting to experience changes to their speech, we might talk about strategies that can help you to improve your speech clarity despite some of the physical changes that might be happening in your mouth. Also important early on is to consider something called voice and message banking, which is the ability to preserve your voice for future use so that if you do experience significant changes to your speech, that you can access your voice later for use with other devices. If our mouth and our hands are impacted, we might tap into other body parts for communication. Here you can see that movements of the head, of our eyes, and sometimes of other extremities might be tapped into to help with communicating as well. Next slide. You can see on this slide some examples of different tools and equipment that we might use to help us to communicate. Know that there are high-tech, mid-tech, and no-tech options, and know that not one size fits all. I think an important takeaway is that not everybody needs eye gaze, not everybody loses their ability to speak over the course of their disease, and somebody might be using multiple tools and modes of communication at once. What a speech pathologist's job is to help you to monitor your symptoms so that we can get you set up with the equipment that matches your physical symptoms and your personal preferences, and also to help you stay a couple steps ahead of the game, anticipating what you might need so that we can get it in your hands maybe just a little bit before you might need it. Okay, next slide. If any aspect of communication is impacted, one of the most natural consequences is that communication is slowed. So here are some general tips that can help to support participation in conversations. Okay, next slide. The second half of what we do in speech therapy is we help to manage swallowing difficulty. Within the context of ALS, there's three main things that we're thinking about as we're trying to help people with swallowing difficulty. The first one is that we want to support efficiency in swallowing. We want to make sure that swallowing is not a barrier to maintaining your weight and getting adequate hydration. We also want to make sure that swallowing is not impacting safety. We want to help to reduce your risk of choking and also aspiration-related events. Aspiration meaning food or drink or your own saliva going the wrong way into your lungs, which sometimes might make people more vulnerable to complications like pneumonia. Finally, I think what is the most important to me is that I want to make sure that people are comfortable and enjoying their food and drink as they're eating and swallowing. Next slide. Okay. As we're managing swallowing, we might do an assessment. We also might have a better understanding of your symptoms and what in particular is giving you trouble. Often I will team up with our dietitian, David, who you'll be listening to next. And I might come up with some strategies to help make swallowing a little bit easier and more comfortable. We might also make recommendations for you to modify the textures of the food and drink that you're taking to help it go down more easily. Okay, next slide. One bit of low-hanging fruit that you can consider is maintaining really good oral care. And all that really means is brushing your teeth in your mouth on a regular basis, 2 to 3 times a day. And that's one way that you can try to keep your lungs healthy, especially if you are having more trouble swallowing. Next slide. Sometimes for people who have really significant swallowing difficulty, there may be a recommendation for a feeding tube. Feeding tubes can be a helpful option for people who are having a lot of trouble maintaining their weight and their hydration by mouth. One important thing to note is that you don't necessarily have to stop eating and drinking if you choose to get a feeding tube placed. And a speech pathologist can help you to guide you as you're continuing to eat and drink, even in the setting of a worsening swallowing problem, to help it make it more enjoyable and safe. Okay, thanks. And with that, I'm gonna pass it on to David.
Hi, good afternoon, everybody. I hope my voice hangs in there. Just getting over an illness. So welcome. So next slide. Here we go. Here we go. So again, I'm the dietitian on the team. I work very closely with Patricia through the visits so that we can have some continuity of care. It's very important for me to know and to work with you to recognize what stage, if there is any change to your chewing and swallowing ability to manage any types of foods, for me to make recommendations and to work with you. So next slide, please. So the most important thing that we know about nutrition and ALS at this point is that we want to maintain weight as much as we can. So what we're doing is we're trying to assess and pay attention as a dietitian to what you're able to do and to come up with strategies to work with you. So we're going to be looking at things to help you maintain your adequate intake, like chewing and swallowing, like I mentioned with Patricia. We may even work with an occupational therapist regarding arm, hand weakness, coming up with strategies. And also we have to recognize how much energy, we've heard this a couple of times, or once already, from occupational therapy and physical therapy regarding energy expenditure and how that might affect our nutritional status, how breathing may affect our nutritional status. So these things are all overlapping together. And that's one of the wonderful things about a multidisciplinary team, is that we can communicate with each other in real time in these visits and pass on the information that we've got so that we can all be on the same page when we're working with you. Yes, probably every single one of the people in there are going to ask you if you've been maintaining your weight, but what we really want to do is help you get there. So we need to recognize these things. We need to recognize how much support you have at home, what's available to you. Are there, as Madeline talked about, is there going to be financial barriers to your ability to keep up? So those are things that the dietitian will also pay attention to in managing your care. And a secondary thing that comes up frequently, and it's really not necessarily a consequence of the disease, but of many of the things that happen with the disease, is poor appetite. It may be related to mood state. It may be related to lack of activity. It may be related to that change in ability to eat food. So there's lots of things that may affect appetite, and that's one thing we'll pay close attention to as we're working with you, and I'm working with you. And then I'm kind of the de facto gastroenterologist on the team, because a lot of these things do impact nutrition, constipation, intermittent diarrhea, which is not as common as constipation, And then there at the end, we talk about things that might prevent adequate intake, such as tube feed intolerance. So next slide, please. All right, thank you. So importantly, we've heard this word a couple of times, is adaptation. I kind of think of this as one of the keys to being successful in maintaining your nutrition, is being able to move and adapt with the disease, because it is a changing process disease, and it's for some people it's rapid and it's hard to keep up with, and for other people there's a slow migration, and keeping up maybe a little bit less challenging. But nonetheless, that adaptation and ability to adapt and to change is hugely important in my experience of people who manage their nutrition. So as I mentioned, working with Patricia on food and fluid consistency modifications, eating aids, breathing support, managing high calorie, high protein diet. This is where I'm going to be kind of essential, and looking at what you're currently eating and coming up with strategies and alternatives to manage that. And then, yes, we'll be involved if that is your part of your goals of care in getting a feeding tube placed. This is where I get involved with the doctor. We have discussions with the speech language pathologist, the respiratory therapist, and occupational therapist, social worker, all kind of collaborating on this kind of decision-making process with you, the patient, to come up with the best timing, to make sure that that you are well cared for. And these things, as we've heard before too, are all individualized. Nobody is the same in their process through this disease, and it's really important to recognize that, because I know that many of you go to meetings and group sessions, and you'll hear one person say, "Oh, you've got to do this," but everybody is slightly different. So we want to make sure that you recognize that that's true. And then, as I mentioned, I'll be very closely involved in any sort of gastrointestinal symptom management. Next slide. So managing these gastrointestinal problems might be diet modifications, how to manage fiber, how to get fluids in. Along these lines, managing your tube feedings if there are complications or problems with bloating or constipation or diarrhea. And we look very closely at medications. Vitamin supplementations are also part of, come into under kind of the area that I'm concerned with. So overall, for me, I love working with ALS patients. It's my most enjoyable job. Despite the disease itself, it's very rewarding. And any questions that anybody has, I'd love to answer them. Always willing to be available for you. So I'll pass it on at this point to the respiratory therapist.
Mira or Lauren, would you like to start?
Yeah, I'm able to unmute, but I cannot start my video either.
Maybe just go ahead.
Great, thank you.
If you can. Yeah, thanks.
Okay. I think Mira was going to take off on the first slide. You're on mute, Mira.
Can you hear me now?
Yes.
Okay. So myself and Lauren, we're both respiratory therapists in the ALS Center. And we can go to next slide. This is how we evaluate patients when we meet them, whether it's on video or in person. We ask patients about their symptoms, about shortness of breath, about waking up rested or tired, about having morning headaches, and sometimes we'll prescribe BiPAP or non-invasive ventilation equipment so patients are able to speak for longer time and also to augment their voice. This is just several photographs of equipment we generally prescribe to our patients. Each one of those pieces requires MD prescription, and prescription then gets submitted to a durable medical supply store who will be contracted with patient's insurance to provide this equipment. From the time we prescribe to the time patient gets it, it generally takes about 10 business days. In most cases, no additional testing is required to obtain the equipment. So if your primary care doctor tells you, hey, we're going to send you to see a sleep doctor, we're going to get you a sleep study, that is not necessarily needed to prescribe BiPAP therapy or non-invasive ventilation for ALS patients. The respiratory therapist from the DME company where we send the order for equipment will come to your home and will show you how to use the equipment. They will also help fit you with a proper size mask. They will show you how to use the non-invasive ventilator machine, which is here. They will show you how to use the suction machine here if you're having difficulty handling oral saliva or secretions. And lastly, the apophysis machine here, which we like to prescribe for secretion clearance and lung expansion, and have patients use it several times a day empirically to help prevent atelectasis and help prevent buildup of secretions, and by doing so, help prevent pneumonia. Next slide, please. We have a handful of patients who are absolutely intolerable to using masks for positive pressure ventilation with BiPAP or non-invasive ventilation. And so, yes, an option is available to use something called negative pressure ventilation, and it's provided through Hayek Medical biphasic ventilation, and it's called negative pressure chest for rest. So it's basically a shell. A shell is connected to a pressure generator, and it basically sucks in and then sucks out your chest wall. And it can be.
I just wanted to add something there. In doing so, it actually sucks down the diaphragm, and that's what
sucks down the diaphragm. And it can be worn during the daytime. It can also be worn at nighttime, and you don't need to have any mask on your face. But it essentially does not replace the need to still use BiPAP therapy. It can, both of them can be used in conjunction. Next slide. Few of our patients use what's called therapy vest. Very commonly is prescribed for patients who have either bronchiectasis or younger generation of patients who have cystic fibrosis. And basically what the vest does, it provides a nice oscillation and vibration to the outside of the chest wall to help break secretions loose, but it does not replace the need for the apophysis machine that actually uses negative pressure to help pull secretions up into central airway where it can be easily coughed out or suctioned out. but it's a nice adjunct for patients who prefer to use this in addition to the cough assist. We actually work with several patients who are on a ventilators invasively and have a tracheostomy tube, who like to use the therapy vest in addition to cough assist. And both of them are covered by Medicare at the same time, we learned. So it's not a problem to prescribe both at the same time. And one of the big questions that always comes up with ALS, can I use oxygen instead of BiPAP? The answer is no. Oxygen is good therapy for a chronic smoker with COPD, an asthmatic, a patient with emphysema, a patient with lung cancer, someone who has whose lung parenchyma, whose lung tissue is affected by the condition they have. With ALS, the condition is affected by diaphragmatic weakness. So using oxygen for this is not helpful. Using oxygen can actually be harmful because it will increase carbon dioxide production and retention in your body, can essentially put you to sleep and you will not wake up. It can be used safely if it goes through your BiPAP machine or through your non-invasive ventilator. We also have some patients who have chosen to transition to hospice care, and they've decided they will not be using BiPAP therapy anymore. And for these patients, we say it's okay for the hospice agency to give them oxygen in small doses, as long as it doesn't make the patient too sleepy and it gives them some sort of comfort and helps with symptoms of shortness of breath. So in this situation, we say oxygen is okay. Next slide. I guess it's time for questions now.
Okay. Thank you so much, everyone. And if our team would like to come off video, then we can start to answer some questions.
Awesome. Thank you guys so much. That was really informative. We do have some great questions, and a few participants submitted questions before the webinar. So I'll include as many of those as I can too. One person asks, how often do you see your patients at UCSF clinic?
Sure. So it very much depends on the patient. For a patient who's progressing quickly, we may see them once a month. For someone progressing on average, we might see them every 3 months. And then we have some very slowly progressive patients that we may see every 6 months. Many of our visits with our multidisciplinary team are via video. So it's more convenient than it used to be able to be seen more frequently. So it's very, very individual, and we work with the patient and family to see what frequency makes the most sense for them.
That's great. And a related question, Dr. Lomenherth, what would an ALS patient expect at a first clinic visit, especially if they never heard of a multidisciplinary clinic?
Yeah, so that's a great question. So when someone is arriving for the first time to our clinic, we always start with the doctor and make sure that the patient, that the diagnosis is accurate and that to answer the patient's questions about their disease. Sometimes that's enough, and the patient is overwhelmed and with all the information and ready to stop there. But sometimes we see patients for the first time who have more needs, and we really need to talk about some of these treatments that were mentioned by our team. And so then we'll ask, would it be okay if you stayed for another couple hours to meet with our multidisciplinary team? And if they're too tired, then we bring them back on another day. But really, the first visit is about establishing the diagnosis, starting treatments to slow the disease progression, starting treatments to help with symptom management, and starting to talk about other equipment and other ways that we can help support the patient.
Gotcha. Another question that's OT related. How can I get occupational therapy at home? I'm having trouble using my bathroom safely.
So what you can do is to talk to your neurologist or your PCP. They can order home health occupational therapy, and they can evaluate your home environment and see what type of equipment that would be appropriate. If you're connected to the multidisciplinary team clinic, you can also like send pictures to the OT and they might be able to give you some guidance on it.
I love that. Thank you.
Mm-hmm.
Couple of questions specific to UCSF. One person asks if you're seeing patients in person now, and how do I get into your clinic?
That's a great question. So all you have to do to get into our clinic is to have your doctor send us a referral to the neurology department and specify ALS. And I can put I guess maybe the participants can't see the chat, but I will just quickly give you the phone and the fax number. The fax number is 415-353 2898, and the phone is 415-353-4138. And as long as they specify ALS clinic, then we will see you.
That's great. And yeah, the participants should be able to read the chat. So if someone pops it in, that's great.
Okay, I'll put it in the chat too. Thank you.
That's perfect. Someone's asking, what is palliative care, and is that a part of the clinic visit?
Madeline, do you want to take that? You're on mute. You're still on mute. There
you go. Okay, sorry about that. Sure, we have the University of San Francisco, California, San Francisco has a palliative care team, which is an amazing team. And so one of the things we talk with our patients about is their goals of care and the types of experiences that they want to be having during the course of their disease. Also, and then if that is something that they want to further discuss, then they can be referred by one of the physicians on the ALS team to the UCSF palliative care team, who sees people right now on Zoom. They have a chaplain and physicians, social worker, and a nurse. And so they are very well equipped to help with goals of care, the discussions and follow-ups and resources. One of their other wonderful programs that they do, or not programs, but services, is they are all experts on symptom management. So all the different kinds of symptoms that you might be having, and this is what the different practitioners will talk with you about. If it's something that might be needing to be managed in another way, and they can put it all together in a global way and address it. And they've just been so clever, and they've helped so many people. So it's certainly worth it to have an initial discussion with them.
I love that. Thanks, Madeline. Madeline, stay off mute. I have another question for you. Can I apply for disability, and does Medicare come around the same time?
That's a great question. You can apply for disability if you're not earning money, if you've worked 5 of the last 10 years, and paid into the Social Security and Medicare system. If you paid into the CalPERS system, you may be getting Social Security when you retire, but you may not be now. You may be getting the benefits from CalPERS. In theory, yes, you can get Medicare at the same time. I did look online about this because I had that same question since the rules changed. And it's 2 conflicting answers, both from Social Security. But I think it's probably coming together. I think that was the initial intent. Sometimes people get their Medicare first because they're getting state disability and they have to wait. Sometimes people have benefits from work where they continue their medical program for 6 months, 9 months, a year, and they stay on that because it covers their family. So there's so many individual ways to do this, and everybody has different needs. It's really important that if you have these questions that you can call Social Security. Just put them on the speakerphone and do the dishes while you wait. That's what I say.
Long waits, that's for sure. Thanks, Madeline. That's really helpful. Just another to circle back, just if somebody is interested in coming to the UCSF clinic, someone says, you mentioned a doctor can refer an ALS patient to your clinic. Does it matter if my insurance policy already has its own ALS clinic? I think probably they're talking about under their plan. And then related, what if you're a Kaiser patient?
Yeah, so I think it just all depends on the Kaiser doctor. So we definitely have had Kaiser refer patients to us for complex patients, and other times they feel that they can adequately take care of the condition within their own ALS clinic. So it just depends on the doctor. And in October of every year, you can always change insurance. So if you feel like you try out the Kaiser ALS clinic and you would like to have a different type of clinic, you could certainly pay out of pocket to come to our clinic, but that would be expensive in the long term. So I would suggest that if you really want to come to a different clinic, that you could consider changing your insurance. But Kaiser has many benefits, many wonderful ALS clinics that are also sponsored by the ALS Association. They often have better medication coverage than other insurance, such as providing sodium phenylbutyrate as well as the TUDCA. So it can be sometimes, there's definitely pros and cons of being with Kaiser versus having other types of insurance. But that's the only insurance that is a little bit more difficult to come here, because we do need the doctor to actually refer you and to authorize the visit.
Thanks, Dr. Lemonherb. This is a question for Mira or Lauren. How soon do you order respiratory equipment for a person with ALS?
Like other clinicians have mentioned, nobody's process is the same. So once we see you, we will go over things, symptoms, if you're having shortness of breath, if you're having difficulty breathing while you're lying down, while you're sleeping, if you're having difficulty coughing and expelling secretions from your airways, we might want to get you started on a cough assisted suction right away. You might also come to the clinic with pulmonary function tests already, and we can look at those results and from there actually have definitive numbers that show that these devices would benefit you.
Got it. Thank you so much. And another respiratory related question, what if I'm claustrophobic with a BiPAP? What are the options?
There are 100 different types of BiPAP masks, so don't give up. Talk to your respiratory therapist. We will find one that works for you.
That's great. A question related to PLS. A couple questions from the same person. Does PLS always progress to ALS? How do you know if you're heading that way? And the same person is interested in hearing more about the PLS study that UCSF is participating in.
I'm sure we have a couple of PLS studies that we're participating in, not testing drugs, but more following progression, assessing quality of life and things like that. So if you're interested, definitely contact us about that. And PLS is variable as far as if it progresses to ALS, when it progresses to ALS. Sometimes people can have PLS, for decades before it changes. PLS is the upper motor neuron form of ALS, which tends to progress more slowly. And that's part of the studies that we're doing, is to try to understand more about that, try to be a little more scientific about being able to answer those types of questions about when people progress to PLS.
That's great. Question about TUDCA. Do you recommend the use of TUDCA?
Sure, I'll have David take that one, because that often comes up in your visits, David.
Well, I think we're pretty much, yes, as long as patients want to do it, we recommend it. Literature looks good so far. Kathy had mentioned the sodium phenylbutyrate. Unfortunately, that one not covered by most insurances, and very expensive out of pocket, which would go with it. But the TUDCA, yes. And it depends on how it's implemented. Some people gradually kind of work it into their supplementation, because it does come with some gastrointestinal complications sometimes, and other people try to onboard it all the way and see how they feel. But yes, we do recommend it.
That's great. There was a question that came in, or just maybe more of a statement before the webinar from someone who's participating, just asking if you could please discuss the length of an ALS appointment at your clinic and the reasons why it's important for patients to stay as long as they can and take advantage of the experts and the team.
Sure. So we really try to adapt to patients' needs. So sometimes we have patients that are just too fatigued and they say, you know what, I can only have an hour. And so we do our best with what we can in that hour and try to handle other things offline. I think the longest appointment might be 3 or 4 hours. A lot of it is really dictated by patient questions, patient needs. So we really do try to tailor the experience to what the patient can do, what they're up to emotionally, physically, and adjust things accordingly.
That's great. Again, just wondering about, I think, coming to see you guys at UCSF, how quickly can we get an appointment once a referral is received?
So all the referrals that come in, if they say ALS clinic, they go to me directly. And so if you're having symptoms like shortness of breath or progressing quickly, just make sure your doctor notes that in the referral, because those are red flags for us that say, okay, we need to pull out that referral and try to get this person in within a week, ideally. Other times, if someone's well connected to care and they're coming here more as a second opinion, we may have the luxury of waiting a few more weeks. So we certainly try to schedule people as soon as we have openings, but sometimes we need to create extra openings if someone is coming who has more needs. So we certainly do the best we can to get patients with in as quickly as possible.
Definitely. Thanks so much. Madeline, another quick question just around disability and Social Security. Someone's wondering if you can get disability insurance if you're of retirement age already and eligible for Social Security.
My understanding is no. Once you reach your full retirement age, that you cannot get also Social Security disability.
Perfect. Thank you. Someone's just asking, how do I learn more about ALS clinical trials? How do I get involved? How do I find more information?
Sure. So all certified ALS clinics are required to have research as a part of their certification. And so if you just ask whatever ALS clinic you're going to, or you could, be certainly referred to our clinic, we're happy to help you. And then we can go over what trials are available in your region. To be comprehensive throughout the country, you can look at clinicaltrials.gov and just type in ALS, and you can set the search key to limit to currently enrolling trials. Sometimes you can also restrict it to the state. So that's another great place to look as well. And then I'll just answer this one because it's also relative. The question is, does UCSF provide grants for those without Medicare or insurance who want to attend clinic? We don't have any process for doing that, but one reason it's really important to get some sort of insurance is that you will need it in order to get this various equipment that's really critical for you for your disease process. So if you don't have any insurance, definitely connect with us and we can help provide some advice for how to get insurance, because that's really easy to do in California. Everyone should be able to get some sort of insurance in California. So that's the other thing. So, and just lastly, I want to make sure this didn't come up as a question, but patients should know that oral Radicava was just approved by the FDA on May 12th. And so you no longer have to get it by IV anymore. Our nurses are working really hard to try to get that process going, but it will probably take a little while for the drug to get to the specialty pharmacy, insurances to understand what this new oral medication is, but just want to make sure people are aware of that. And then on June 29th, the FDA will announce their decision about whether or not they'll approve Amylex, which is the combination of sodium phenylbutyrate and TUDCA. Any final questions that anyone has? Just really appreciate everyone being here and coming and having such wonderful questions.
Yeah, thank you so much, Dr. Lomenhirth. Oh, there's one more popping in.
Yes, it's the same team that travels to the satellite clinics. Yes.
Yes.
We go everywhere together.
That's right. This is our awesome UCSF team that's out and about all over the state of California, and we're so grateful for it. And
well, thanks to your support, we couldn't do it without the ALS Association funding our satellite clinics. So thank you so much.
I'm so pleased that all of you made some time to be here tonight. I really want to thank each of you for participating. I think we're ready to pop up some other slides. Thank you so much to all of you for joining us, everybody in the audience, all of our panelists. We're really grateful to each of you just for all of your time and commitment, for being a part of this community. Once again, a big thanks to Mitsubishi Tanabe Pharma America for their support. I want to remind everybody, we have some June events coming up, so please mark your calendars. June 2nd is Lou Gehrig Day, and we have a number of baseball events upcoming to celebrate this important day. The National ALS Advocacy Conference is coming up in mid-June, as well as the next segment in our Ask Me series on June 21st. So please join us for any and all of these events. As you know, philanthropy fuels everything we do, and we're grateful to committed donors who give generously throughout the year. To learn more about how you can support the valuable programs we offer, including programs like this one, please visit our website at give.alsagoldenwest.org. And please watch for the short survey on tonight's presentation that you'll receive in order to help us plan for future educational programs.